Welcome, everybody. Today's topic is evaluating the literature in animal-assisted interventions. And we do have a guest lecturer today. We're very excited that Ellen Herlash-Pretzer could be with us. I'd like to take this opportunity to introduce Ellen Herlash-Pretzer. She is a great colleague and a dear friend of mine. She is a professor and has historically been the program director with a Master of Science in Occupational Therapy at Saginaw Valley State University. She's also a certified professional dog trainer with years and years of experience. She's been a field representative and consultant with Paws with a Cause, and she has everything from paid work to volunteer experience in working with assistance dogs, which remember are dogs that work with people. They're trained and permanently placed with people with disabilities, but also animal-assisted interventions. The organization she works with does place dogs with therapists. She is also co-author and advisor for a gazillion multiple research studies and publications focused on both assistance dogs and animal-assisted interventions. So we are very fortunate to have her here this evening. And
so, like Melissa said, I am Ellen Herlash-Pretzer. I am very excited to present to your class. I was going to say research nerd, but it's cool to like research, so I'm not going to call myself a nerd. My primary teaching responsibility as an occupational therapy faculty member is I teach classes in evidence-based practice and research. So I work with our graduate level occupational therapy students in developing and implementing their master's thesis capstone projects. So as Melissa said, I'm occupational therapist by training. Over 20 years, I hit my 20-year mark this year, which scares me because there's still so much to learn. Also, as Melissa said, I do have quite a bit of experience with assistance dogs and also gaining more and more experience all the time with the animal-assisted interventions part. I work and volunteer for an organization called Paws with a Cause. We're based in Wayland, Michigan, which is by Grand Rapids. And we train and place service dogs for people with disabilities. And we also train and place facility dogs to work with various health and human services professionals and educational professionals in different types of settings. I've also done a post-professional rotation in animal-assisted interventions with Melissa as well. So I've got some hands-on experience with that, as well as doing placements and working with some of our clients and our teams through Paws with our placements. If you hear any squeak in the background, both of my dogs have frozen Kongs right now to keep them occupied. So just had to show off pictures of my dogs, of course, because that's what we do as animal people, right? So Ingle is my demonstration dog for Paws with a Cause. He is trained to do different types of service dog animal-assisted interventions work. So he works with me when I'm working with clients applying for a service dog, presentations, demonstrations, things like that. And the little nerd on the right is my my current foster puppy, who I'm raising to be a service dog. He is, like I said, a standard poodle. He is so much fun. Oh my goodness. I was hardcore not team poodle, and I am so on team poodle now. He is just so much fun. I'm not on team doodle yet. Nothing against doodles. But anyways, so those are my little nerds. If you hear me go, stop humping your brother, it's the dogs. That's all my other disclaimer when I do online presentations, because it's really awkward otherwise. Okay. If you have questions, I think you can either just pipe up as we go along or wait till the end, however you normally do it in class. So what we want to talk about today is we're going to talk about evidence-based practice, what it is, and how it impacts our roles in health and human services professions. Now, Melissa, is everyone in the class working health and human services in some capacity?
yes.
Okay, cool. And then you guys touched on this a little bit, which was really cool, but some of those factors that impact the quality of research in animal-assisted interventions, and then some of those things we want to look for when we're looking for good quality animal-assisted interventions research. Like Melissa touched on, as well as Phoebe, and I'm sorry, the other student who presented their article. Just because it's research doesn't mean it's good, or it doesn't always mean it's applicable to our situation. Animal-assisted interventions, it continues to evolve, and we're continuing to get people to learn more about the terminology, how we integrate animals into practice. And so as people get more skilled with it, we develop a better body of knowledge and more professionalism around it. The research goes with that as well. So again, what we're going to talk about is this idea of evidence-based practice. So evidence-based practice has been around since about the 1970s is when the concept first came about. And it was developed in Canada at this place, McMaster University. And it's at its core, evidence-based practice is the integration of the current best available research evidence with our clinical expertise and our patient values to help us make the best decisions when we are working with our clients in whatever setting we are working in. And I'm going to clarify why I said that in a little bit. But again, these three components. One of the things with evidence-based practice is that it is becoming more and more widespread. As health and human services professionals, we talk about this quite a lot with working with our clients. We are pushed as healthcare professionals, obviously, to do the best we can for our clients. Traditionally, that has meant taking what we were taught when we were in school and going, well, that's what my teacher, who was an expert, said to do, so I'm going to keep doing that over and over and over. The cool thing about healthcare is that we keep learning more all the time. And we keep learning new interventions, new medical procedures that can help us get people better, faster, and more efficiently. So we have to stay up on that research, because if not, we're not doing the best for our clients. So one of the big complaints that people sometimes have about evidence-based practice is like, well, it's all based in research, but I'm a clinician and I have experience and my people aren't participants, they're actual people. The beautiful thing about evidence-based practice is that it does, again, allow us to use our practitioner expertise, that body of knowledge we've developed over time, and it allows us to integrate our patient values. So what is important to our clients that we work with? What are the things that they want out of treatment? And what are the things that we can do to help them achieve those goals? One of the things we know with healthcare is that it's not always about quantity of life. It's also about quality of life. We all have different things that are important to us and that we value and we want to be able to do. And whatever outcome it is that our client wants to achieve, that's going to impact what the best evidence is and how we should work with our clients. So evidence-based practice is actually really, really client-centered. It's just adding in that research evidence. The other thing that's really cool about evidence-based practice is that this is a huge thing in health and human services. When I graduated in 2002 from OT school, I had never heard the term. It's been evolving over the past several decades. It's been gaining more traction, not only in health and human services, but even in other fields. For example, in October, I went to the Association of Professional Dog Trainers conference, and they talked about essentially evidence-based practice, but they were talking about evidence-based dog training and talking about how when we are working with animals and when we are working with our clients, we can't just do the things that we have been doing the past 20, 30 years, because that's how we trained dogs when we started. They talked about how we have to keep looking at the research about how animals learn and how people learn. And we have an obligation to animals and to humans to stay up to date on that research and then apply it to our specific clients. So it's all over the place. Healthcare, mental health, even dog training, it's all there. The other thing that's neat about evidence-based practice, and I think Phoebe, you may have touched on this in your article summary, is that that's what third-party payers are expecting. We know that healthcare funds are very tight. There's limited funding. With clients, you may only get a handful of sessions with them. And the third-party payers are expecting you to make progress. And if you're not making progress, they're not going to pay. They're also many times only going to pay for interventions or therapeutic approaches that are based in evidence. So if we aren't doing things that are based in evidence, or if we don't have research to support the things that we want to do, like animal-assisted interventions, then they're not going to reimburse for those services. So again, whether we want to do it or not, we need to be at least aware of what evidence-based practice is and how we integrate it into our work on a daily basis. So what evidence-based practice really does is it gives us that confidence with our interventions. It allows us to say this thing that I want to do, or this approach that I want to use works, and this is why. So when you have an employer who's like, why would you bring your dog into work? How is that going to help? It's going to make a mess. It's going to bark. Why would you do that? Evidence-based practice allows us to go, animal-assisted interventions is an evidence-based approach to practice. By integrating this, this animal into our work with us, we're going to be able to help our client achieve their therapeutic goals. And by the way, my client's goal is to do ABC, and I can integrate the animal to help this client achieve this outcome. So again, all it is really being able to explain to people what we're doing and why, and supporting why it works. So now that we know that evidence-based practice really is the standard of practice, it's something that we have to do. Not only that we have to do, but we should really want to do for our clients. We have to really figure out how to do it. And so looking at the journal articles is that next step, looking at the literature, looking at the research that is out there. And this can be tricky. Melissa talked about some of these things, and we're going to expand on them a little bit more. Hold on, my dog's Kong is stuck in a corner. Oh, you got it. What a smart boy you are. So many places where dog toys can hide. So in order to engage in evidence-based practice, you have to be able to find good research. As Melissa touched on a little bit, not all research is created equal. Just because something is out there doesn't mean automatically it's good and we should be using it. And that's particularly tricky with animal-assisted interventions because, and please jump in, Melissa, whenever you want to as well. Animal-assisted interventions, it's been around for a while, but not standardized. I don't know if I said that right. There were a lot of people doing the pet therapy or bringing an animal in, but it's only been more recently that they've started to get standardized terminology, things about these are best practices in animal-assisted interventions. These are frameworks and guidelines for practicing this. And so you have to have some of that standardized terminology, standardized guidelines for practice to be able to start to have some quality research. And so that can make it tricky to find, again, some of that good research that you can generalize to other areas of practice. So what we're going to talk about, or what are some of those things to think about or look at to help you be able to find that quality research? So some of the big factors is availability of sufficient time and resources to do research. So in terms of people even doing research studies to begin with on animal-assisted interventions, again, finding the time and resources can be tricky. Doing research studies, it takes time. You have to find the right research questions. You have to do literature searches. You have to figure out your experimental protocol. You have to get participants, gather the data, analyze it, all that good stuff. That takes time. And it can also take resources, whether it's having assistance, having the money to be able to pay to do things, whatever that is. And there's not always a lot of money out there to do that research. Another big thing is using the correct terminology. I know when I first dipped my toes into the water, knowing the difference between AAA and AAT and AAE and EIEIO, and oh my gosh, it was like alphabet soup. The more I dug into it, the more I'm starting to be able to sound fairly intelligent using all the abbreviations, I hope. But that being said, with some of the articles that you've looked at, you've probably seen where people are like, oh, we did animal-assisted therapy, but what they actually did was but they did visiting animals where they brought their animal in, the dog visited with someone. So it was animal-assisted activities, but not necessarily animal-assisted therapy, but they said they did therapy, but they actually didn't. So now you have an article that's like, we got great outcomes from animal-assisted therapy, but it wasn't that. So that makes it tricky to be able to look at that research and actually apply it. Again, there's more organizations out there now, places like Animal-Assisted Interventions International, and there's starting to be more and more standardization of terms, which will help the research going forward. But especially some of the older research, it can be really tricky. So you have to be a skilled reader of those articles. So like, even if they say it's one thing, you can read between the lines and go, it's not actually that. The other thing that we need to talk about, and Phoebe, I know for sure you talked on this with that article you did, were things that affect generalizability, sample size and composition. This is a really hard one in any kind of healthcare research. I always tell my students this. It's really easy to do research with lab rats because you can breed a whole line of multiple generations of lab rats that are all the same. You control the environment, you control other stuff. But it's very easy to have a big sample size of lab rats. People are not the same. If you want to do research on, for example, children with autism, we know every child with autism is different. You cannot develop a standardized protocol that you are going to do the exact same thing with every child with autism. That is not going to work. If I'm looking for clients, for example, who are stroke survivors, every stroke is different, every client's different, every goal is different. We have to individualize our treatment. So to get a big sample size where you have a bunch of people who are very similar and they're all doing the same intervention is just impossible really in healthcare research. So that's the downside, is we can never really get big sample sizes. So it doesn't mean we can't do research or we can't generalize our findings, but we have to take it with a grain of salt and just realize it's going to be a buildup of a lot of small studies over time that's going to help us get this really good body of knowledge. The context of the study. So again, in what setting does a study take place? Looking at things like the physical setting, like for example, in rehabilitation, you could do outpatient, you can do acute care inpatient, you can do inpatient rehab, you could be at a skilled nursing facility. So if you do a study, for example, in a skilled nursing facility, is that going to generalize if I work in an acute care inpatient hospital setting? Maybe, maybe not. We also have to look at cultural factors. Different countries or different parts of the country, different cultural or ethnic backgrounds may have different experiences with animals. They may interact with them differently. And so a study that's done in one country may not be applicable to our country or our culture or the group of people we're working with. Even things like the context of that specific healthcare setting. Healthcare settings difference in terms of management support, all that stuff that can affect generalizability as well. And finally, the study design is huge. Not to go into the weeds with this, but certain types of studies like randomized controlled trials, which are like your standard drug protocol, you get a placebo, you get an actual drug, which one works better? Those are the gold standard. It is very hard to do animal-assisted intervention research and go, you're either in the intervention group or the control group. You either get a dog or not a dog, but I'm not going to tell you which group you're in. That doesn't work really well. So it's hard to get really high quality studies for animal assisted interventions. And that can make it hard for us to be really confident in our findings and the ability for us to go, these findings would generalize across settings. Another thing we have to look at is confounding factors. These are factors that aren't a part of my study. They're outside of my study, but they can still affect my outcomes. In animal-assisted interventions, that's a huge thing. So for example, I love golden retrievers. I'm scritching my golden retriever's rump right now. I think he's the best dog in the world. If the interventions with my golden retriever turn out really, really well, was it the animal-assisted intervention itself? Or was it that I have the world's best golden retriever and he was the thing that made it work? Or was it the fact that I'm a really good handler with my dog? And so we were the thing that made it work. It wasn't so much the protocol, it was the two of us together. Or maybe like with Melissa's clinic, Gertie is a pretty cool dog. She's right up there with Ingle. So again, was it Gertie that made the difference? Was it having Gertie and Woody together that made the difference? Was it the fact that the client could choose their own dog that made the difference? Or was it the actual intervention? So you can have a lot of the, especially with animal-assisted interventions where we know that the animals have their own distinct personalities and clients click with specific dogs. How do we know that it was the intervention versus this one specific dog or this one specific person making that connection? And that can affect our generalizability as well. So those are all, again, those are all factors you have to think about. It's not going to be like, oh, I can't apply this article. You have to just be a skilled consumer of research. Don't assume just because an article was published that it is 100% true and awesome. Let him chew. Thank you, buddy. Don't assume that study is awesome. You are allowed as a skilled consumer of research to look at a study and go, this part's good. This part may not be good. So I'm going to apply it, but I'm going to take it with a grain of salt. So now we're going to look at, again, dig a little bit deeper into some of those characteristics of quality research and how do I find quality research in animal-assisted interventions. So one of the first things to look for is peer-reviewed journals. So peer-reviewed journals, I tell my students, if they're really boring to look at and boring to read, it's probably peer-reviewed. If it has pictures, If it has color, if it has advertisements, it's probably not peer reviewed. So a peer reviewed journal, you're probably all familiar with these. Again, they look very formal. They have citations of other sources throughout the article, especially in things like the review of the literature part. They're citing prior research upon which their study is built. They have things like an abstract at the beginning. They have, excuse me, where are you going, Ingo? There's your chewy. Don't disconnect my stuff, thank you. They have the sources that they pull things from. They have an abstract at the beginning that's going to give you a summary of the article. They have a very detailed method section where they're going to walk you through step by step what they did. It's also going to be written by an authority or expert in the field. Now, again, people have to start out. I mean, not everyone is born an expert. So you may see people you don't recognize, but hopefully you're seeing someone who has some background. Most research is done in partnership and collaboration. So hopefully you're going to see someone who is an expert with maybe some other people as well. How do you determine who's an expert? You can look at their credentials. You can look where they're from. And also, as you start to read more and more literature, you start to see those names pop up like, I've seen that person a couple times. I think they know what they're doing. So the more you dig in, the more you start to learn really who knows their stuff. You'll see discipline specific and specialized terms. So for example, in occupational therapy, you're going to see things like occupational performance or performance components or stuff like that. Same thing for things like education or counseling or psychology. You'll see some of those very specific specialized terms. Another dead giveaway, the title will probably say journal or review or research in it. So look for those things as well. You're going to see, again, you're going to see that audience. Who is it appear to be written for? It's not going to be written in an exciting way, and they're not going to be like, here's a catchy headline for you. It's going to be written very straightforward in an academic manner. Now, the good thing about getting articles from peer-reviewed journals is that they are reviewed by experts in the field before they're published. So the peer reviewers are typically people with experience either in research and or the area of specialty, in this case, animal-assisted interventions. They're going to review the article. They don't know who wrote it. And they review it for things like the quality. Was it a good research quality? Was their methodology good? Did they do a good job of getting participants? Did they analyze their data correctly? Did they make some solid conclusions? So, and again, you're not going to see a lot of advertising with it. So these are all things to think about. If it's boring and you're like, this looks like a painful read, it's probably a journal article. I hate to say that, but it is what it is. One of the other things to think about with journal articles is that as a professional, if you're not working in academia or if you don't have a connection to a university, it can be sometimes hard to get journal articles. More and more places are starting to publish what are called open access, which means you can get these really good quality journal articles for free. Off of things like Google or off of the journal's site. If you're in a situation where you can't get them, that's where you want to make friends with faculty or staff at universities. So you can be like, hey, I saw that this new article came out. Any way you can get it for me and send it to me. And that can be a great way to get stuff as well. Some professional organizations offer access to journals. For example, as an occupational therapist, our professional organization, AOTA, offers access to ProQuest as part of our membership, or not ProQuest, American Journal of Occupational Therapy and British Journal of Occupational Therapy. And then our NBCOT, which is our registration board, offers us free access to ProQuest. So always look at what are some of those subscriptions or access things you get as a professional. And then again, make friends with people at universities. It makes it much easier. We can access stuff that you're not able to. So as you're looking at an article, Eric, that's his toy, not yours. Thank you. As you're looking at research, what are some of the things that you should look for to help you make a decision? Is it quality and is it applicable to what you're looking for? It should describe the protocol in detail so that you can look at it and go, yes, this was indeed some form of animal-assisted interventions. Again, especially if you're looking at older research, you're going to see a lot of things where they say we did animal-assisted therapy, but again, it was a visiting therapy animal. So they didn't integrate the dog or the animal into a session that was goal-directed and facilitated by a skilled professional. So even if the title says it, for example, it was animal assisted therapy, you want to make sure that you can confirm for yourself that that is indeed what it was. And the way you can do that is by reading through that protocol. The other cool thing is when they give a detailed protocol, you can look at those results and go, wow, these results showed that this intervention worked. I would like to do that same thing. I can follow steps that they gave in that journal article. You also want to look for some of the background about how the animals were trained. What kind of background did the animals have? What kind of experience did they have? So you want to make sure, again, these animals were able to be integrated in ways that help to facilitate that therapeutic process. By knowing what kind of training the animals had, then that also, again, helps with that ability to generalize and to apply things. Okay, these animals, came from an organization that specializes in training facility dogs. So I know the dogs in here had a higher level of training. If I want to replicate this, I need to make sure my dog has that type of training. Okay, they used, younger animals. They had, a therapy dog. Oh, Melissa, I can't remember the term, certification, registration. Sorry.
Yeah, so it's really hard to offer a certification because there is no governing board.
Yep, I'll get the term right eventually. Was the animal registered with, for example, pet partners or something? So that again helps the level of training of the animal. They should talk about the screening procedures for the participants and the animals. So how did they determine who was appropriate to be included in the study? What were the characteristics of the participants in that study? And that's really, really important to know, because if, for example, the study involved animal-assisted interventions or animal-assisted therapy, and the clients were all young children with autism, but you're working with, adults with chronic mental health conditions, does it generalize? Maybe, maybe not. Looking at, again, the screening procedures that they used for the animals as well. How did they make sure that the animals were a good fit? We know that all animals have certain preferences. For example, my golden retriever, he likes young kids if they drop food on the ground. He also likes college age students. That's what he's all around. Older people is like, they're cool. That's okay, but whatever, it's not my jam. So knowing how did they assess that animal's appropriate fit, make sure the animal is safe. That's also going to help you go, okay, in my clinical situation with the animals that I'm thinking about integrating, are they appropriate? How should I make sure that the animals are appropriate? What things do I have to do to make sure they're safe and my clients will be safe? And that rolls into the next one, discuss protections for participants and animals. What were the things that they did to help make sure participants were safe and animals were safe? And that's something that was talked about in the articles. What were the protections for the animals and clients? And what were some of the things that they were missing? The article about Hobbs and talked about how, they hugged Hobbs, and it wasn't really clear if Hobbs liked that or not. And again, that helps with that idea of that generalizability and actually being able to apply it in your own work with clients to make sure that you're applying that protocol like they did and you're protecting people. The final thing that quality research should have is they should have a limitation section where they talk about both the strengths and the limitations of the study. There's no study that is perfect. One of the things I always tell my students with dog training and with research, when you fix one problem, you create another problem. So you look at what is the biggest problem I need to address, and I address that one, and I acknowledge that by fixing that problem, I'm going to make a bigger problem here. For example, our research, looking at kids with autism. If I want to be able to have a decent sample size, I'm going to have to really open it up. I can't have everyone as the same. It's like, okay, you're a child with autism, you're between this age group and age group, great. Now I have a decent sample size. But the downside is there's a lot of diversity in my samples. So I can't be totally confident it was the intervention that caused the outcome. I fixed the problem, but I created another one. Say that you were like, I want consistency in the dogs that I involve. So I'm only going to have 2 dogs in my study. So I know that I can control the animal situation. Well, that means it might not be as generalizable because, again, was it the animal that we involved, or was it the fact that we had this specific dog involved in the study? So a good research is going to tell you what were the strengths and what were the weaknesses, and then you can be aware of those as you try to apply them to your own work with clients. So looking ahead to research in animal-assisted interventions, again, there's a huge need for research, just like in anything else, especially with animal-assisted interventions, because the field is still relatively young-ish, and we're making good progress in research, but the more that things are standardized with terminology and approaches, the more need there is for research. So future research, again, we need larger sample sizes. That's always going to be the challenge. But that's one of the biggest limitations you'll see across the board. So how do we get around that? Sometimes multi-site studies. So sometimes you'll see a research study where they're like, we worked with 5 different clinics. Well, that's cool. If each clinic got 5 clients, you're up to 25 now. So the cooperation across researchers is really good. The more that people get familiar with the terminology and the practice of animal-assisted interventions, the more that collaboration is going to be able to occur. Another big thing that we need to look at, and is also a good thing to look at when you are looking at research studies, is looking at outcome measures, standardized, reliable, and valid outcome measures. Sometimes we're tempted to come up with our own tools to assess outcomes, which can be good, but the development of good outcome tools is a field in and of itself. It involves a lot of math stuff that I don't know, but people do mathy stuff and then make sure questions are good. And we're actually measuring the things we want to measure. So if you are reading research or if you're doing research, really see, did they use standardized tools? Did they use quality tools? So we know we're actually measuring the thing that we want to measure. So one of the things I tell my students, for example, is things like quality of life and depression. They kind of look kind of similar, but they're 2 different things. And if you're not using a good tool, you might think you're measuring quality of life and you're actually measuring depression, or vice versa. So looking for standardized tools in the research you're reading, so we know that we're actually measuring what we want to measure. And if you're doing research or even just working with clients in your clinical situation or your professional situation, use those standardized tools. So we really have objective evidence that yes, this intervention helped this client. Looking at optimal research designs, a lot of the research in animal-assisted interventions is very small. It's case studies where we have one individual, or a case series where we only have 2 or 3 individuals, or it's surveys where we're asking people about their opinions. Those aren't bad. They're a great place to start, but there's better research designs we can do where we're actually doing pre-testing and post-testing with good tools and good standardized protocols. And that's really that next step that needs to happen in research in animal-assisted interventions to help legitimize the field. You know, a lot of people, we know in our souls that this works. We've seen it, we know it. Third-party payers don't care about your feelings. They care about what are the outcomes and what does the evidence show. And the higher quality research we can get where we're doing kind of experimental interventions where we're pre-testing and post-testing, or having one group participate in animal-assisted therapy and another group doesn't, the more evidence we have to go, this works. This is something that's legitimate. This is something that I can integrate into therapy, help my clients, and you can pay me to do it. Integrating controls for confounding variables. That's a lot of syllables in that sentence for a Tuesday before Thanksgiving, my goodness. What does that mean? We talked about things like thinking about what are some of those things that could be issues that would make it so I can't generalize my findings. Like, oh, was it the animal-assisted intervention that worked, or was it Gertrude, the awesome dog, that made the difference? Was it the animal-assisted interventions, or was it the fact that we had a really skilled handler working with the dog? So we have to think about what are some of those outside factors that could affect our findings and try to control for them. So if they did a study in animal-assisted therapy, did they have 3 or 4 different dogs that they worked with and 3 or 4 different handlers? If they had 3 or 4 different teams and all of them got good outcomes, that's gonna make me go, I bet you the intervention worked, because it didn't matter if we had Gertie or if we had Ingle, the Wonder Golden Retriever, or a silly poodle doing it. They all had good interventions. So I always try to think of what are the things where people would go, well, your study didn't work. What would be your mic drop? Like, oh yeah, it worked. Boom, already addressed that. And those are those things we have to think about with research. We also just need to look at optimal applications of animal-assisted therapy. What are some of those situations where this is really a good intervention? We know animal-assisted therapy can work in a lot of different situations, but we want to find out what are the most appropriate settings. What are maybe some of the populations, the treatment settings, the diagnoses that animal-assisted therapy is most effective with, so we can really maximize our use of resources. We know that it can be hard to get handlers. It can be hard to get quality animals or dogs. We know, for example, again, dogs have a limited work span. They can't work 8 hours a day, 5 days a week, 52 weeks a year. So if we really want to look at how can we best integrate animals into therapy to have the highest impact outcomes, we need to start researching that. What's the best way to integrate into practice? What are the best clients and the best situations? And the more we can do research on that, the better we can make use of resources and make sure that we are integrating animals in the best possible way.